be seeing a slide that says bottom line up front. And this slide is kind of a look at really the last 6 months, a little more of COVID here in Mason County. And, you know, we quit looking at cases per day as a measure of what's going on because they fluctuate so dramatically. I get asked the question a lot of times, you know, why don't your figures agree with DOH's figures? And a lot of it's because of the way the data is transmitted. People get their lab tests, goes to DOH, comes to us, and we don't always get it in a timely way. And sometimes, as this first graph shows, we had a really straight up climb on Omicron. And very little hang time at the top, and it came back down. You see we have a bump on the right-hand side of that graph. Well, the bump really is cases that were double counted. So DOH is in the process of sorting those cases right now and eliminating the double counts, and you'll see that graph change over the next week as that gets updated. But it is an interesting graph in that you see from July to about the 1st of January, we had Delta, which peaked, and then it just kind of bumped along like kind of a sawtooth thing going along for months. It didn't really come down much. Then Omicron hit and really rapidly replaced Delta and took off like a space shuttle, went up, like I said, didn't have a lot of hang time. It's coming back down. And really over the last couple of weeks, we've seen a dramatic decrease. And I'll come to that here in a second. We are seeing that the number of hospitalized patients and deaths has remained about the same. So there's good news there. Hospitalizations down about 4%. Deaths over the last 2 weeks are 14, and test positivity was up as high as 67%. So think of it as people who felt symptoms and they went to the hospital or they went to the hub up in Eureka and got tested with a PCR test. 67% were positive, so people were pretty aware they were sick and they were getting tested. The test positivity is coming down, which means that people are having symptoms, but the symptoms could be from other things. So we've got strep throat and staph and some other things going around. Colds, I mean, we've got colds going around. And then at the bottom, you see fully vaccinated, we're at 60%, 5 and up, 63%. And where we've done a really good job is our 65 and older, we're at 84%. So we're really cocooning those folks that are in their later years. So I've done a good job there. Next slide. Let me put this into slide mode here. Oh, wow, let's through that. Slides are back. Okay, so we're running an average of 41 cases a day in Mason County, and that's 71% decrease since last or 2 weeks ago. It's huge. I mean, that's some of the best news we've had in a long time. I'm so pleased it didn't go up and then bounce along like Delta did. So Omicron is certainly a different kind of a variant, and it really mimics more of what we expect to see in a virus, where you do have a rapid increase, very little time at the top, and a rapid decrease. It should be parabolic. And Delta just was not that. Delta was completely different. It came and it stayed for a long time. We're about 1 of 6 residents, and that continues to go up because it's cumulative. And I think what we may start to see is that between vaccinations and people who've had COVID, if we get this new variant, which is the BA2 variant, or they're calling it stealth variant, there may not be a lot of people left to infect. So, and that's kind of what we're hoping as we go forward. Moving on. So this is the beginning of the pandemic. So we've got deaths, a 7-day death rate. You see we had a real spike in December. That was kind of at the end of Delta. So Delta was pretty severe. We had people across the state, a lot of people on ventilators and had a lot of problems. And here in Mason County, we had a pretty high death rate there for a while. Omicron came in and replaced Delta. We peaked up, but we stayed below 10 deaths per week. And right now we're at 6.1. So if you think of it that way, if we were 100,000 population, of course we're not, but if we were at 100,000, you could expect 6.1 deaths per week. And we're kind of tracking right on that. We're at 14 deaths over 2 weeks. So the data is like a cross check. It seems to be checking out. This one's interesting though, hospitalizations. So hospitalizations are a little different. You see how when we first started out, we had some hospitalizations January 21, another bump. July of last summer, I remember after we declared victory across the state, well, Delta came along and put that to rest. And we had a lot of hospitalizations up and down across the board. And then we got into we're starting to come off of that. Omicron hit, and we had a lot of hospitalizations. And that was pretty dramatic. Part of that, we got very close to exceeding our capability here in the hospital. Now, across the lower Puget Sound region, there were a lot of hospitals that were at capacity. Mason General stayed right at capacity, but we never really had to exceed it. We've had cases like this in the past. In 2018, we had flu that was severe that we were actually shipping patients as far as Portland to get them into hospital beds. So this is really successful for us. Our staff beds were able to take care of the hospitalizations that we had coming our way. So this has been an interesting ride. A lot of our hospitalizations are those folks over 65. We've seen a lot of that. Our hospitalizations are far more with the non-vaccinated than with vaccinated. So the people who are vaccinated or who have had COVID in the past have had lighter symptoms. They have not gone as heavily into the hospital. So there's a misnomer out there in the media when they say Omicron is mild. And from a medical point of view, mild means fewer cases going to the hospital. But what has happened is because it is so infectious, even though it is milder and fewer people are going to the hospital per 100,000, because there is so much more, the math just works out that we have more people in the hospital. That delta between the two just slides up the scale, and we have more people in the hospital. So that really explains why our hospitalizations were so high with Omicron. They are coming down now, and that is good news. It's nice for the first time in a long time for me to come out and say, hey, we got some good news around COVID, because I've been like David the Bad News Bear for a long time. This one was interesting. I thought I'd bring this out. We've got this is children from 0 to 20. And part of the graphic didn't come up, but that teal colored line are kids from age 12 to 19, or 12 to 18. And you see, we've got, this is across the state. This is not Mason County, this is across the state. I'm gonna be very clear about that. And then the next line down, surprisingly, is the other end of the spectrum, is the 0 to 4 category. And that was surprising to me. And then we have the 5-year-olds to 11-year-olds in the purple. We're kind of chugging along at the bottom. You see, through most of the pandemic, the different groups kind of were aligned, but boy, when we got to Omicron, the teens really shot up, and then the little kids shot up as well. So more in the hospital, but I need to put that in perspective. If you look over the right-hand side of the graph, you see that hospitalization rate is 10 per 100,000, whereas we were talking in case rates, we're talking 1,600 per 100,000. So the rates of kids were very low, but they had increased dramatically over what we saw previously, which was kind of surprising to a lot of us. It kind of follows the same track that H1N1 did back in the mid-2000s. And in that it started off with older groups, but then H1N1 became more prevalent in the 35 to 45-year-old category, and it really settled in there. And this looks like it's kind of settling in on our youth. So that's a little disconcerting. But again, it's coming down dramatically. It's almost a vertical drop too. So that's also good news. All right, here's where things start getting a little bit weirder. With the governor plans, last week the governor announced that surgeries are back on for starting February 18th. And that was great news. When the governor, in his last announcement before that, took surgeries off the table, I was scheduled for a surgery. And while the governor was still speaking, I got a call from Mason Health saying my surgery was canceled. So very efficient up there at Mason Health. And then last night I got a call from Mason Health saying, okay, Dave, your surgery is back on and let's schedule a date. So kudos to Mason Health. They are all over this. It's just, they've got a great surgical team up there, and their schedules are just on top of what's going on. The outdoor mask mandate coming off at the end of this week, and that really didn't apply to us here in Mason County that much because it really affected groups of over 500. So think Oyster Fest, which didn't come off. Think Forest Festival, which is coming up. And then the Christmas parade could have fallen under that. We did that differently this year, which was kind of a lot of fun, actually. But not a whole lot of change in that category. What's going to change is the change to the indoor mandate. So as of right now, there's no change, but we expect the governor to be on at 2 o'clock to announce what he's planning to do. As most of you know, California is taking their mandate off. Oregon is taking theirs off as of the end of March. So we're looking to see if the governor has some sort of what his will look like. Now, if he does like he did last summer, this is how it looked. If you were vaccinated, using the fully vaccinated criteria, and I can talk about that in a sec. If you're fully vaccinated, you could take your mask off indoors. If you were not vaccinated, you had to wear your mask, but in either case, you had to show your employer if you were vaccinated or not vaccinated. There at that time, there was no provision for those who had COVID to have that count towards their immunity status. So some of us have pushed the governor to talk about, instead of vaccinated or unvaccinated, talk about immunity, using immunity as kind of the standard by which we measure things. It's harder to do because we don't know right now the level of antibodies it takes to provide a protective factor. So that's still under study. We hope to find out more about that as time goes on. There's a lot of studies being done. Like I said, we should have an announcement today on the indoor mandate. King County is relaxing the vaccine mandate for restaurants and bars. That was as of yesterday. So that was a new announcement from Jeff Duchin and the new mayor up there in King County for Seattle. So that is coming off. We still have to the north of us vaccine mandates for bars and restaurants in Jefferson and Clallam counties. I'm not sure what their health officer is going to do. We will know more on that probably late this afternoon because we're meeting with all the health officers. So throughout the pandemic, we've been meeting with health officers every week and then with DOH every week to talk about these big things and to try to get some feedback to the governor's office through DOH channels about what we're actually seeing on the ground and trying to influence some of the decisions that come out of Olympia that in some cases make sense for large urban areas, but didn't make allowances for rurals and the different circumstances we find ourselves in. So we're hoping that our pushback this week will be heard by the governor's office, and I guess we'll find out here in a couple hours. Next slide. All right, near and dear to everybody is testing. So 2 weeks ago, we put out 20,000 masks. So we had the N95 masks. We got a shipment of N95 masks, which unfortunately were short dated. So we didn't even put them into the warehouse. We just unpacked the pallets where they were and got them out to the community. So it went any number of places. We put that out on social media for people to go pick up N95 masks. Unfortunately, they were one size, but it's what we had. So it's what we put out. I did order 40,000 test kits through the state. We've received 14,000 test kits from the state. And then I had ordered 9,000 test kits out of a fund that I had available. And that first batch of test kits came in with a printing error or labeling error, we'll call it a labeling error, on the boxes. And I had to send those back because FDA had considered them to not be available for use for what we were trying to use them for. So sent those back, ordered another 9,000. So we've got kits in. This last week, we got a bunch of those kits out. We sent them to Hoodsport, Belfair, Shelton. We got them out to a lot of different places. And you can see that on social media as well. And then for county employees, we had a situation where we could do 1 kit per person, 2 kits per family, and I had collection points for those. This group of 9,000 test kits that we just got are a little different than the other ones in that they're single test boxes, but they have really good instructions in Spanish and really good instructions just using pictures. So we're going to use a lot of those kits to reach out to some of our non-English speaking county residents and then get them out to employers, especially employers that have large number of immigrant employees. I think these test kits will work really well for them. So we'll be getting those out this next week. Part of the advantage of coming here to talk to you folks is to kind of get some feedback. And that's why, as soon as I wrap up these slides, is to find out, kind of who's needing what, and kind of get some feedback on where the community would like these tests to go, because we've had great support from the chamber and other folks, but didn't get around to everybody. I mean, we had the initial batch was fairly small. Getting test kits out to employers is going to be our next one. And then again, support for skilled nursing facilities, because they do go through a lot of test kits. We're not supplying a lot to the schools unless they run out, mostly because schools have their own pipeline that's being filled through the OSPI. So not doing as much with schools, like I said, unless they run short, and then they're certainly welcome to get a hold of us. So we are using test kits to support some activities that are coming to Mason County. So we've got some, I would say conferences, but some groups are coming to Mason County, and we want to make sure they have access to test kits and masks as well. Testing update. So the states opened up their Say Yes to COVID test site. Initially, they had it out there and it was sold out within 8 hours. They've got some test kits in again, and that is out there as well. So that is an antigen test, which is actually my preference for using for testing, in that it really shows me as a public health guy who is contagious. PCRs, tests like we do at the labs and at the COVID center, at the hospital, and at the hub in Belfair, are a much more sensitive test, and they can really show us that you've had COVID. My concern really is about who is infectious at the time. So a test that's just as selective and less sensitive, like these antigen tests, these home tests, really tell me who is infectious and when. And for us in public health, that's really kind of the important piece. And then we're going to be coming out with some processes for these tests to priority groups this next week. And that, my next slide will kind of cover where we're going with that. I realize I'm going through a lot of this really fast, so if you have questions, hang on, I'm almost through. So case investigation. So since the beginning of COVID, we've done what's called case investigation and contact tracing. And Monday at 7:45, we were told that as of 8 o'clock that morning, DOH was closing much of the CICT activity. So it was very little advance notice to us. What they're still going to be doing, though, is investigating outbreaks. So if we have outbreaks in skilled nursing facilities, jails, prisons, nursing homes, we'll be investigating those. And then still investigating unusual cases. Let's say we have an outbreak amongst kids that strikes us as being unusual, that's not epidemiologically linked. We'll be looking at those. And then folks over 65 years old are going to be investigated as long as the sample is less than 4 days old. You can get a call probably from DOH or from us on those. But they'll not be calling and notifying most cases that turn up positive that go through the state system. The home kits don't go through the state system. For the most part, people don't call in and say, hey, I have COVID based on my home kit. And the state is really taking an approach that we're going to take this to an endemic instead of a pandemic. So endemic like flu or like colds, those sorts of things. We're really kind of using the flu model, that if you use a home kit and you find that you are positive in the home kit, it's going to be up to you to notify people around you, your close contacts. The state's not going to be doing that. So we're really going to be transferring a lot of the responsibility for managing the disease back over to the patient, back over to people. Give people power to do that, give them the test, give them the masks, they have access to vaccine, and to try to build those layers of protection. So think of it as layers of armor. You've got a vaccine, you've got a mask, you may have had COVID. Each of those builds on each other to provide more protection. So what do you do if you've tested positive? We've got this guidance out online. What do you do if you've been potentially exposed? And I get tons of phone calls at home on these things. People are very concerned about, especially I think a lot of the churches, a lot of the social groups call me at home to ask about this. And then there's going to be some guidance for daycare, schools, et cetera. It's going to change based on the mask guidance that's going to change. So if the governor changes the mask guidance substantially, we'll need to change how we talk about isolation and quarantine. And as soon as I wrap my head around that, I will get that out to them. We're assuming that everything right now is Omicron. We're watching for BA2 to come out. We've had 2 cases of BA2 identified in Washington. And people need to understand that in testing for these things, it's like testing a chocolate chip cookie for chocolate chips. It's a random sampling, and you may hit a chocolate chip or you may not. Same kind of a thing with these. We may hit a BA2 case and we may not, because these are random samples derived from the larger sampling set. We'll be looking to help private employers obtain test kits. As a public health jurisdiction right now, we're in pretty good shape with test kits. And the newest test kits, like I said, have excellent instructions in Spanish, and there's a single test per box. So it gives us a little more flexibility than the early ones we got, which were 5 test kits per box. And then, like I said, we'll change some of may change some of the quarantine and isolation guidelines based on what the governor has to say this afternoon. Okay, that is my last slide, and I'm going to stop sharing.